Happy Monday to all of our volunteers of the pet prescription team. Since our meeting is not going to be until October the 2nd, there are some issues that have transpired that need immediate attention. Therefore, I decided instead of emailing you that I would put a video together to outline some of those areas that need our attention as an organization. On Friday, I went to Kaiser Permanente and audited the facility. One of the goals in doing so was to see how our program is being utilized and what we might change to better our visits as well as how we visit. I met with the child life specialist in the pediatric ward as well as the child life specialist in oncology. I also met with different nurses and staff members to just get their input on how things are going and what we might need to change. I'd like to outline some of those areas and basically deal with the protocol in which should be followed at Kaiser Permanente. I'd like to deal with oncology first. When our volunteers arrive on Mondays, Wednesdays, or Fridays, that they would go to oncology first. I was talking with Sandra, the child life specialist. One of the things that she shared with me was that our volunteers are not spending a great amount of time just hanging out with the kids. If you're struggling for ideas of what to do, bring a brush for the kids to brush your dog. Bring some outfits for the kids to dress your dogs up with. Bring some books about dogs and share with the kids about dogs. We're there for the kids, and we're not there to do speed visiting, but we're there to spend time. And if there's only 2 kids there, spend time with those 2 kids. It's about the quality, not the quantity in which you visit. So oncology is your first stop when arriving at Kaiser on Mondays, Wednesdays, and Fridays. Once leaving oncology, you will make your way to the children's pediatric ward in the main hospital. What we are asking is that you will go directly to pediatrics. There is a fear of cross-contamination if you stop by the lobby or visit with other people before entering pediatrics. So to assure that that does not transpire, we're asking that you go directly from oncology to pediatrics. Once entering pediatrics, you will get your census sheet. Please look at the census sheet to know which rooms that you will be visiting at. Protocol in visiting at Kaiser Permanente or any of the hospitals in which we visit are as follows. When entering a room, make sure that you have sanitized your hands. Once entering the room, ask all those present, would you like to pet my dog, or are any of you allergic to dogs? If they would like to interact with your dog, then you will take a sanitizer which you have brought and hand to the patient before they begin to pet your dog. If you have a small dog which is to be placed on the bed, make sure you use a sheet, place it on the patient's bed before putting your dog on the bed. Once the dog and the patient have finished their visit, you will remove the dog from the bed, take the sheet off the bed, place it in the hamper which is located in the patient's room, and again hand a sanitizer wipe to the patient to wipe their hands. Then dispose of the sanitation wipe into the patient's trash can. Once you have completed your visits on the pediatric ward, you will take your census sheet that you have checked off and you will place it in Mitzi's mailbox, who is the child life specialist for the pediatric ward. Her office and mailbox is located to the middle waiting room in the pediatric ward. After you have completed your visits on the pediatric ward, by all means begin visiting throughout the hospital. Don't forget to hit all the lobbies where family members are waiting for their news about their family member. Another issue that was brought to our attention recently are dogs that are being taken into restaurants, grocery stores, different places like Costco, wearing a pet prescription team therapy vest. It is against our policy. You will be removed as a member if your dog is in any of those places wearing our vest. Those vests are only to be worn when out on a specific job in which they've been trained to do. You are jeopardizing our organization's insurance, as well as placing more liability out there for our organization. That is against our rules. So I would ask that you would not take your dogs to places in which they are not to go, and take them only to the places in which they are authorized to go. Another issue that was brought to my attention recently, which was just by happen chance, I'm sure, but that two factors. Number one is that dogs were visiting without wearing their vest. All pet prescription team dogs must be wearing a pet prescription team therapy vest when out on a visit. I have said it. I don't know how to say it any differently, but that is a requirement by our organization. The other issue that was brought to my attention is that some volunteers are changing vests out and then using them on other dogs in the family. Well, that again is against our policy. The dog that was certified through our organization is the only dog that is to be out on a visit, as well as interchanging a vest is against our policies. Remember, the next pet prescription team meeting is on October the 2nd, which is a Sunday evening at 6:30 p.m. All pet prescription team meetings are held at the La Habra Heights City Hall, located on Hacienda Road in La Habra Heights, California. So, in closing, I'd like to thank you for the time that you've spent watching this. I hope you found some of the issues that I've hit on to be informative, as well as asking for you to comply with some of the rules that we have in place to protect this organization, as well as protect you as a volunteer. I look forward to seeing you on October the 2nd, and for those of you that are not going to be able to make it, you will find the minutes of that meeting located in the file section of the Yahoo group after that meeting. But remember, it is a requirement to attend our pet prescription team meetings, so if you're coming close to not complying, we'll see you on that Sunday. Until then, thanks.